It is the most abundant protein in your body and the scaffolding for skin, bones, tendons, ligaments, and cartilage. If you've only heard about collagen for wrinkles, you're missing the bigger story. As we age, we don't just lose muscle. We also lose collagen density, and the quality of those collagen crosslinks declines. That shows up as creaky knees, slower tendon recovery, and weaker structural support. Today, we're zooming out to see what collagen actually does, what the science really says, and how to fit it into a smart longevity plan that goes beyond mirror deep. If you're new here, welcome to Longevity Compass. We make science-backed habits simple so you can live longer, stronger, and better. Please tap like and subscribe if you find value here. It helps us reach more people. And a quick reminder to check the description for research-backed tools and our book, Longevity Compass, which puts morning and evening routines, nutrition, recovery, and training into one simple system. You never have to buy anything, but if you're ready to act, we've curated trusted options to make it easy. What collagen actually is, and why your body cares. Think of collagen as biological rebar. It is built from long chains of amino acids like glycine, proline, and hydroxyproline, twisted into a triple helix that gives tissues tensile strength. When you consume hydrolyzed collagen or gelatin, your gut breaks it down into small peptides. Uniquely, some of those peptides, especially a dipeptide called prolyl hydroxyproline, show up in the bloodstream and act like tiny text messages to fibroblasts and chondrocytes. Those are the cells that build skin, cartilage, and bone. They receive the signal and nudge toward repair and synthesis. This signaling effect is a big part of why collagen behaves differently from generic protein powders. Skin, beyond vanity, it's your barrier organ. Let's start with what most people notice first. Multiple randomized trials and meta-analyses show that daily hydrolyzed collagen can improve skin hydration, elasticity, and wrinkle depth within 8 to 12 weeks. Most study doses range from 2.5 to 10 grams per day. This is not just cosmetic. Skin is your first line of defense against the outside world, an active immune barrier. Better dermal collagen supports barrier integrity, moisture, and resilience. So yes, your face may thank you, but so will your biology. Joints and tendons move well, age well. Mobility is longevity. It is not poetic, it is practical. Your risk of disability skyrockets if pain prevents you from moving. Two areas matter here. First, osteoarthritis symptoms. Collagen peptides have shown modest, meaningful reductions in knee pain and improvements in function in human trials. It is not a miracle cure, but for many people the difference is just enough to keep walking, training, and staying independent. Typical doses are about 10 grams per day of hydrolyzed collagen, or around 40 milligrams per day for undenatured type 2 collagen, also known as UC2. Second, tendons and ligaments. Here's where timing becomes a secret weapon. In a clever experiment, athletes were given 15 grams of gelatin along with a small amount of vitamin C about an hour before jump rope sessions. Markers of collagen synthesis increased, suggesting a prime the tissue, then load it strategy. In plain English, if you take collagen or gelatin with a splash of orange juice 30 to 60 minutes before tendon-focused exercises, you can potentially nudge those tissues toward building and repairing. Practical examples include heel drops for the Achilles, isometric knee extensions for the patella tendon, and forearm pronation and supination for elbow tendons. Combine these with a collagen preload and you have a targeted connective tissue protocol that fits real life. Bone, the undersold benefit. Bone isn't just minerals. The organic matrix is about 90% collagen. Minerals like calcium harden that matrix, but collagen is the scaffold that prevents brittle fractures. In a 12-month randomized controlled trial in postmenopausal women, specific collagen peptides increased bone mineral density and improved bone turnover markers compared to placebo. That is a big deal for long-term fracture risk. Doses in these studies were around 5 grams per day, often alongside vitamin D and adequate calcium. If you care about staying independent into your 70s and 80s, this is a lever you can pull. Muscle, where collagen fits, and where it doesn't. This is where a lot of people get confused. Collagen is not a complete protein for building muscle. It is low in essential amino acids, particularly leucine, the key trigger for muscle protein synthesis. Head-to-head, whey protein outperforms collagen for stimulating muscle protein synthesis in older adults. So if your goal is hypertrophy or preserving fast twitch muscle with age, prioritize complete proteins like whey, dairy, eggs, high-quality meat, and soy. But here is the nuance. In older men with sarcopenia who performed resistance training, adding collagen peptides increased fat-free mass and strength versus placebo. Why? Because any extra protein helps, and because collagen may enhance connective tissue adaptations that let you lift more and recover better. So do not rely on collagen alone to hit your daily protein target. Use it as a smart, joint-friendly addition to a complete protein strategy. Think of it like this: use whey or a complete protein after lifting for muscle, and use collagen or gelatin before tendon-heavy training for connective tissue. You get the best of both worlds. Is there an anti-aging pathway here? There is an intriguing angle around glycine, the most abundant amino acid in collagen. In multiple animal models, extra glycine mimics some effects of methionine restriction, improves metabolic markers, and seems to encourage autophagy. We do not have human lifespan data yet, so think of this as a promising bonus mechanism, not the main reason to supplement. Dosing and timing, a simple, practical guide. For a daily background dose for general tissue support, take around 10 grams per day of hydrolyzed collagen. For skin-focused goals, use between 2.5 and 10 grams per day for 8 to 12 weeks, then reassess. For joint symptoms like knee osteoarthritis, consider 10 grams per day of hydrolyzed collagen or around 40 milligrams per day of UC2 for at least 3 months. And keep moving because supplements are not a substitute for strength work. For bone support, 5 grams per day of specific collagen peptides alongside vitamin D and adequate calcium is supported by human trials. For tendon or ligament sessions, take 15 grams of gelatin or collagen plus around 50 milligrams of vitamin C. A small glass of orange juice works, 30 to 60 minutes before tendon loading exercises. Collagen does not need to be taken fasted, and it does not need to be post-workout unless you are targeting connective tissue with that preload strategy. Consistency beats perfection. What to buy, and what to skip. Hydrolyzed collagen powders from bovine or marine sources are the standard, daily choice. Marine collagen often dissolves easily and is popular for skin, while bovine collagen usually provides types I and III and is widely available. UC2 is a specific undenatured type 2 collagen used at tiny doses for joint comfort. It is not interchangeable with standard collagen peptides. Because supplements aren't pre-approved like medications, quality matters. Choose brands with third-party certifications like NSF Certified for Sport, USP Verified, or Informed Choice. Independent testing has raised concerns about contaminants across some protein powders on the market, so vet your brands and look for transparency and batch testing. If you have fish allergies, avoid marine collagen. Fish collagen can trigger reactions. In that case, stick to bovine sources. Now let's talk about safety, side effects, and who should avoid it. Collagen is generally well tolerated. Some people notice mild stomach upset or a sense of fullness at first. If you have chronic kidney disease or are on a protein-restricted diet, talk to your clinician before adding daily protein supplements. Remember, collagen is low in leucine and tryptophan, so it should complement, not replace, complete dietary protein. Building a collagen-smart longevity routine, sample week. Start with a daily base, 10 grams of hydrolyzed collagen with breakfast, in coffee, smoothies, or yogurt. Keep total protein intake around 1.2 to 1.6 grams per kilogram of body weight per day from complete sources. 3 days per week, strength train with full body compound lifts and slow eccentrics to stimulate muscle and bone. Use a complete protein like whey post-workout. 2 days per week, add targeted tendon work. Take 15 grams of collagen or gelatin with a splash of orange juice 45 minutes beforehand, then do your tendon loading block. For bone stimulus, include impact or power elements as tolerated, gentle step downs, light hops, or weighted carries. Support skin by maintaining SPF, using retinoids if appropriate, and taking 2.5 to 10 grams of collagen daily for at least 8 weeks before you judge results. Rapid-fire FAQs. Can you build muscle with collagen? Not efficiently. Use whey or another complete protein for muscle protein synthesis, and use collagen for connective tissue benefits. Can you just drink bone broth? Bone broth is food, not a standardized supplement. Its protein content varies wildly. Enjoy it, but for consistent dosing, use hydrolyzed collagen or gelatin. Marine or bovine, which are both functionally similar for most goals. Choose based on allergy status, budget, and quality. Best time to take collagen? Really any time for general use. 30 to 60 minutes before tendon loading work if you want to nudge connective tissue synthesis. Bottom line, collagen is not a magic youth serum. It is connective tissue nutrition. Human trials support benefits for skin quality, joint comfort, and even bone density. Use collagen alongside strength training and adequate complete protein to protect the structures that let you move, lift, and live independently for decades. That is the real longevity play. Not chasing magic molecules, but taking care of the tissues that carry you into your 70s and beyond. If this helped, please like and subscribe. And remember to check the description for research-backed collagen options, plus the link to our book Longevity Compass, your roadmap for routines, nutrition, recovery, and more. You never have to buy anything, but if you are ready to act, we've done the research so you don't have to. Thank you for watching Longevity Compass. See you in the next one.